We're facing the deadliest drug crisis in American history. Never seen anything like this. I started in the 70s as a young prosecutor, prosecuting heroin cases. And the percentage of heroin in a seized item was often 15% or less. And what are we seeing today? Based on preliminary data, approximately 64,000 Americans lost their lives to drug overdoses last year. That would be the highest drug death toll and the fastest increase in the death toll in American history. And that would mean that more Americans died of drug overdoses last year than died from AIDS at the peak of that epidemic, more than in automobile accidents. For Americans under the age of 50, drug overdoses are now the leading cause of death. So I want to say thank you on behalf of President Trump. He spoke about this crisis is driven primarily by the opioids, prescription pain medications, heroin, and synthetic drugs like fentanyl. In 2015, opioids were responsible for most of the fatal overdose deaths in this country, killing more than 33,000 Americans, quadruple the number 20 years ago. Last year, there were 1.3 million hospital visits in the United States related to these drugs. It's an extremely costly thing for the entire American economy and our social fabric. People lose their jobs, they go to jail, they lose their lives, children get addicted, families break up. It's not a good thing. People they should never minimize the danger and destructive capacity of these drugs. In law enforcement, it's a remarkable heritage you have in your 22 years. When excess drugs are sitting in our medicine cabinets, it's that much easier for them to end up in the wrong hands. That's the idea behind the Drug Enforcement Administration's National Prescription Drug Take Back Day, which is tomorrow. By giving people the opportunity to dispose of unnecessary and potentially dangerous drugs with no questions asked, these events make us all safer. 32 years in law enforcement, and I appreciate Angel Melendez, a number of experienced prosecutors to opioid hotspots. In August, I announced new resources to find and prosecute the fraudsters who flood our streets with drugs. The first new resources is a data analytics program called the Opioid Fraud and Abuse Detection Unit, which will help us find the telltale signs of opioid-related healthcare fraud by identifying statistical outliers. It's not that hard to do. They can tell us which physicians are writing opioid prescriptions at a rate that far exceeds their peers, how many of a doctor's patients died within 60 days of opioid prescription being written, the average age of patients receiving prescriptions, pharmacies that are dispensing disproportionately large amounts of opioids in regional hotspots for opioid issues. The fraudsters lie, but the numbers don't lie. And now the fraudsters can't hide if we do this properly. And foreign taxpayers of more than $1 billion, more than